The way that I would define health equity is that everyone has these same opportunities and the same resources available.
Well, because we're a small organization with 2 employees, my son, who is my business partner, have always talked about the importance of health because each of us depends on each other for a specific part of the business activity. My son is the key implementer of our business, and I'm business development. So we just know it's important for us to stay healthy. And so we're trying to make good decisions about, rest and vacations and balance. And so far, it's been really good in the 2 years we've been in existence.
At Peak Mind, we define health equity as just making sure that we're providing as many solutions to as many people as possible is our own definition of equity within health.
Health equity is defined a lot of different ways. I think for the chamber, we have members in the healthcare space who think about it as clinical outcomes. I think for us, it's about recognizing that a person's physical and mental health are, just an incredibly massive part of what predicts their sort of success as an individual, their well-being as an individual, their ability to participate, whether that's in an economy, in a neighborhood, in a family, whatever it is. I think health and well-being is absolutely core to that. And we know that there's really uneven access to clinical care, to community assets, to a neighborhood that's safe and clean and that you can enjoy, And so for us, it's when we think about equity on a large scale, on an economic scale, health equity is a core component of helping to work towards a situation where everybody gets to participate and benefit.
The way we define health, equity, wellness is making sure that our team is operating at its best self, both mentally and physically, so that we can better serve our community.
I think we try to be really holistic in our definition of health, equity, and wellness, and look at health across a lot of the things we've talked about here today, but talked about mental health, physical health, financial health was one that I was like, oh yes, I think we don't talk about it enough. I think we feel like, okay, we pay our people well and try to do that, and then probably leave too much to the individual. So I think it's just a great reminder that even when you think you're doing well in those areas, thinking about them again and addressing them at least annually with all your employees is a really good idea.
I think it's giving the same opportunities and access to any employee that would be there.
So we partnered with the IU School, Fairbanks School of Public Health, and the IU Kelley School of Business. The thinking being, we want to work with the top experts in the world to think about what are the public health strategies that have been tried by private sector entities, have people out there in the world invested in their employees, and what results have they seen, and then can be recommended to other companies. And then from the IU Kelley School of Business side, what does it look like to take those really successful strategies and translate them into a spectrum where maybe this is day one for me as a company of thinking about investing in health equity for my workforce. I need to start somewhere, right? And so starting somewhere is success. So let's start somewhere and then move up the spectrum. That is one end of the bookend. The other end would be my company has spent 10 years really intentionally investing in health equity. I want to take it up a notch, and take it to the next level and participate in this conversation. We've got recommendations for them as well. So our partners in academia really helped us to build that spectrum. The Workforce Pilot is charged with rolling it out and getting that in the hands of people doing the work, real companies out there in the community, helping them implement that in their workforce.
We do contract a lot of our work. We made a conscious decision during the founding of our business that we would operate very lean. We're a lean company. And so we are very focused on making sure that our contractors are handling their employees with the same level of care that we handle ourselves. Are the employees given proper health care plans? Are they being given counseling on how to, present work-life balance in their lives? And so it is still important for us to make sure that our contractors and consultants are as healthy as we are.
We don't necessarily strategically think about health equity in the hiring process other than diverse hiring and inclusion, but we want to make sure that we're considering people with disabilities or, that just don't look the same as others. However, we don't ask people their health conditions when we hire them on, so that's kind of illegal.
So for us, it's trying to determine what is the best possible outcome for our team. Ultimately, we're here to serve. And so if my team feels like they're being supported, valued, and seen in the workplace, then I feel like that helps us to be better stewards in our community. And so things that we try to do in the office are making sure that our team have access to healthy options from a food perspective and a snack perspective. Making sure that we're listening to them about the things that are important to them from a family standpoint and how it's impacting them at work. So for example, one of the new programs that we're implementing is we have a lot of young mothers as team members in our office. And so on the first day of school, they'll have a late start and an early leave on that day for the first day of school, because I know as a mother, that is always a day full of anxiety, and you want to be there for those big moments for your kids. You want to see them have a healthy breakfast and to be able to get off to school and then to be there to greet them when they come home. So having that as an option without them having to worry about taking time off or not being paid for that time, that's something that we're going to make sure that our team members have access to.
I think there's a real emphasis on practicing it while preaching it, and I think we're trying to all get better at that. So if I'm going to tell you to be mentally healthy, I should be working on my own. If I'm going to work on my own physical health, but be sure that we talk about it. And I think something that's been reinforced today for me is let's just not make an assumption that everybody's getting it, or that we've all been inundated with messages of be healthy and drink a lot of water and get good sleep. And now it's like, no, let's really as a company say this matters to us. And we know that if we do that well, one, that we retain employees, two, they're probably more productive when they're there, and then three, we're hoping that that recruitment then also follows that as well, that other people can see that looks like a healthy place to work. I think we all come into businesses and we kind of engage, does this look like a healthy workplace? What does that even mean? Maybe different to each person, but trying to be healthy more intentionally, I think is very worthwhile.
The biggest challenge is it's something that companies aren't necessarily able to ask about. So if we really want to address health equity, but yet we can't ask it, it's put you in that position of how do you take care of your employees and try to give as many solutions as possible without really understanding truly how many people might struggle with. Talk about Crohn's and colitis. You can't really ask somebody how many times do you need to go to the bathroom and do you need a waiver to spend an hour in the bathroom. But that is a problem that a lot of our adults face. And so how do you create a solution and try and meet the needs of as many people as possible? I think that's a huge challenge.
Really, it hasn't been an issue to this point. We do a lot of client lunches and breakfasts and dinners, and so we've had the conversation that we've got to be a little bit more judicious in our calorie counts, because when you're entertaining a lot, you start to eat things outside of your healthy choice menu. A lot of steaks, clients love steaks, clients love to be entertained. So it's really become more of a conscious effort of how do we balance, reducing some of those meals or doing more breakfast meetings instead of dinner meetings, eating at different locations that serve healthier choices for lunch. So we're very conscious of that as it relates to what's happening in our business model.
I think what I've realized is we can't assume that everybody is just doing it or already knows it. And I think generationally it matters. There are we have really young employees that are barely out of college, which means that they're still kind of learning as young adults, what does sleep hygiene mean for me now that I'm out of school? What does getting enough exercise and things like that? Some people come by that honestly, but other people need to work on that. And then we put them in a relatively high stress job, which is a relatively sedentary job. So you're a lot of hours at your desk, be that at home or at work, wherever it is. And so not assuming that, oh yeah, they'll take care of themselves around that. I think we need to more intentionally say your whole being and your whole health matters to us as your employer. And here are some things we can put in place to make that better for you.
As we look at upcoming open enrollment in the fall, I want to look at some different models maybe for health insurance that would be more favorable to everyone and not just focus on those that can afford premiums and that kind of thing.
I think this idea that health and well-being, again, is not a nice to have. It's a core component, it's a foundational element of what it makes a person ready to show up and participate in a company. And that for the company, when we think about productivity, when we think about attracting people, when we think about this talent challenge that everyone is struggling with in a massive way, health and well-being has got to be a core component of that. And making investments in employees' health and well-being is going to be an indispensable part of dealing with your talent challenge.